Hello everyone, it's lecture number 1 and it's about classification of drugs. We can classify the drugs in multiple ways, and most importantly, we can classify them by their pharmacological effect. The second way is by their chemical structures. Third one is by their mode of action. Or we can say site of action, and the fourth one is by target system. First of all, we will discuss about pharmacological effects. What is meant by pharmacological effect? Pharmacological means any biological effect of a drug in your body. Means how the drug interact with your body and cause any biological effect. Right? We can group the medicines, different drugs, on the basis of their effects. Like any drug could be analgesic. Analgesic means painkiller. Right? Painkiller is a generalized term. In terms of medicine, we can call it as a analgesic drug. Then any drug could be antibiotic, the very famous one. Then we have antipsychotic. Similarly, antihypertensive drugs. Then it could be anti-cancer. Anti-cancer, anti-inflammatory, and then number of other drugs. But for a single drug, it's very difficult to define a specific pathway. Like if we have a pain in your heart, right? So there are multiple ways to treat this problem, and there are multiple drugs to have a different type of mechanism to deal with this problem, right? And the selection of drugs is also depend on the medical history of a patient. Right? A single drug can cause could have multiple effects, like any drug which is sedative. Sedative means sleep inducing. It could also be anticonvulsant. What is meaning by anticonvulsant drug? Like in epilepsy, when the muscle movement is not in our control, the uncontrolled movement of muscle is called convulsant movements, right? Then we can also take the example of many antibacterial agents, right? So specifically antibiotics is the only class of a drug which is having specific mode of action. Like for different problems we have different antibiotics. For rest of the things we have a confusion, like a single drug can be used for multiple purposes. Okay, the second class is by their chemical structure. Apparently, different drugs could have a similar chemical structure, right? Like you can take the example of barbiturates. Barbiturates, what are the barbiturates? They are sleep causing drugs, right? Then we have another class which is called opiates. Opiates are they are derived from opioid. The right spelling is opioids, right? They are what is called opiate because they are originate from opium, right? And they are used for intense pain, right? Usually it is given to cancer patients, right? Similarly, you can take the example of steroids. You know, although most of the steroids are having similar structure, but they have entirely different mode of action. Um, if you consider the example like why we are using steroids and why we are not supposed to use steroids, like it is general perception that it is not necessary. It's a not good. Mm, it is a not a good idea to use steroids. Steroids are actually derived from the word corticosteroids, right? They are synthetic drugs. They are not the natural drug. The previous one could be natural. Okay, how the steroids work? They actually reduce your immune system, reduce the activity of your immune system. What will happen whenever we want, whenever we have a problem in our body, or we have an immune system, right, to protect us, and it is born according to that particular change, right? When you suppress, steroids are actually immunosuppressants. They suppress our immune system, so our immune system is unable to respond any change, right? So that is why we can use such steroids, but we cannot take the steroids for a longer time period. Maximum, which is suggested by doctor, we can take the steroids for a year, for 1 year at maximum level, right? But at the same time, there are certain people, those are using steroids. Steroids are good for, they may enhance your physical activity, physical stamina, uh, physical things, right? At the same time, it also enhance the muscle growth, right? That is why it is banned for all the players, the people those are involved in physical activities. Okay. Then we have another class of steroids which is called anabolic androgenic steroids. If I write it clearly, anabolic androgenic steroids. Like you can take the example of testosterone. Testosterone, it's a hormone. Basically, steroids are hormone derived, right? The corticosteroids are like you can consider cortisol. Cortisol is a natural hormone which is generated by our body, right? So similarly, testosterone is a hormone which is present in more amount in males, and it is controlling the growth of hair, deep voice, and gender specific features. right? While most of the drugs connect at several sites of your body and have different pharmacological effects, right? So the next category is by target system. This is a very specific kind of a classification. Specific, right? Because here we need to, the drug need to, locate the specific system where it has to attack, right? Like you can take the example of antihistamines. Antihistamine जैसे भी आप उसे बोल रहे हैं, right? And they are actually responsible for the release of neurotransmitters. What is neurotransmitter? They are the chemical which are responsible to convey message from one neuron to another one. They are built upon our nervous system, complete nervous system. So it's very important to communicate normally in a healthy way through neurotransmitters. Histamine release in brain indicate the release of neurotransmitters, right? System by which histamine synthesize, release, interact with the receptor. Um, they can be attacked by at any stage of any antihistamine factor, right? So how they act in our body, this is important to know. They actually block the neurotransmitter in our brain which is called acetylcholine, right? Acetylcholine is responsible for a number of things in our body, like it can control the memory, it can control the muscle contractions, right? It is important to consider their role, right? Something more about antihistamine, right? They actually stop histamine to affect cell in our body, right? Anti is stopping histamine to affect our body, right? What is happening uh, whenever we have, if there is a harm in our body, what histamine do, if we have a harm in our body, right, such as an infection, right, it causes blood vessels to expand, right, and skin swells, so it appears like an inflammation, right? So in this way it is actually protecting our body, right? So it is mandatory. So this is a system dependent thing, right? But at the same time, there are certain limitations with it, like if you're taking it overdosing antihistamines, right, then they can harm your brain, they can cause fatigue, and the third, they may cause lack of motivation. Okay, then lastly, fourth one is by site of action. I have a very tiny whiteboard of RIP by site of action. They are, in this category, the drugs are grouped according to the enzymes and receptor with which they interact. Like you can take the example of anticholinesterase. It causes the inhibition of acetylene, yes, acetylcholinesterase, right? So the main thing is the site of action is a highly specific thing, but at the same time it is less specific than the system targeted system. There we have a specific site of action where the drug cannot interact. But in case of a site of action, like in this particular category, right? If you take any drug, right, it can choose multiple ways to reach out any particular point. It also be possible that particular drug can take a different route, which is like if it is a target, you can take the example like if this is the target, this is the particular site of action, and you have taken a particular drug. Drug can, it's very rare that the drug directly reach to the site of action, right? So it will choose the multiple modes and interact with number of things before reaching to the particular site of action. And sometimes it's not necessary that it reach to the target even, right? So in this particular case, you know we may have a negative effect of any drug, right? So it actually identify the precise target at which the drug act. To find out the precise target is important, right? If drug is that much sensible to identify the precise target, then we can say that this classification is such kind of a drug is sensible enough to select is its site of action. It's all for today. Thank you.